Hi, my name is Dr. David Nicholl. I'm the health spokesperson for the Liberal Democrats. On Freedom Day, or as I prefer to call it, Freedom Day, we are within the NHS and indeed social care, I think, in a very difficult position in that essentially the government's made a decision to open up no rules, no enforcement of masks in public spaces. When cases are going up, deaths are going up, and ITUs are full, and even within the Birmingham area we're redirecting patients from ITU to different intensive care units because of capacity. This is going to affect care because we know that patients with COVID on ITU stay on ITU longer than patients that don't have COVID. So it means patients with cancer surgery and other things are going to get delayed. And it's very difficult to know what's going to happen next because, in fact, the actions that Rishi Sunak and Boris Johnson made yesterday, where they said that they were going to a pilot study and didn't need to self-isolate, and it was only because of the adverse publicity that they did a complete U-turn. And this totally trashes the public health messaging, so it's actually going to make it much more difficult to manage. This is something that I've been highlighting over the last 18 months or so. So as Liberal Democrats, I think we just need to keep highlighting the importance of the public health messaging, but I have to say the Conservative actions make it very, very difficult. And it's very difficult because I think Boris Johnson, if you look at the 70 or so members of the so-called COVID recovery group, essentially the reformed ERG, are essentially a bunch of headbangers, and they are the most unevidenced based group of people. And yes, we know there are harms from lockdowns, but there are harms to both health and wealth by the dithering that Johnson and his cronies have done over the last year. So I think we're in a very, very difficult place. And we in the NHS haven't got a choice, but I think the next few weeks are going to be very difficult indeed.